Municipal Health Officer of Los Baños, Laguna, took his clinical training and graduated Doctor of Medicine at UER MMC, a pediatric residency training at UPPGH, and a Philippine Pediatric Society Inc. Fellow. Again, our moderator for this evening's activity, Dr. Alvin A. Isidoro.
Okay. Good evening, fellow doctors and pediatricians of the Philippine Pediatric Society. And good evening and maraming salamat sa ating sponsor, ang NurtureMed. Maraming salamat sa inyo. Tonight, we have a very relevant and timely topic to be discussed by our invited guest speaker. Relevant kasi sa panahon ngayon na pandemic, how do we approach COP ba? Yung mga umuubong bata. Lagi na lang suspect COVID. And lately, relevant kasi nagkakaroon tayo ng outbreak ng asthma because of the vaccination ng 12 to 17 years old. Sa dami ng medical certificate ng bronchial asthma, parang nagkaroon na tayo ng outbreak. So hopefully with the lecture of Dr. Sayao, we will learn again, lalo-lalo ngayon dahil uso ang online consultation. So our speaker for tonight is a fellow of Philippine Pediatric Society and a fellow of Society of Pediatric Critical Care Medicine Philippines. He is an attending physician at De La Salle University Medical Center and president owner of AAS Healthcare Medical Management and Consultancy, coordinator at AHMCS Training Center, and Assistant Chief Medical Officer and Medical Advisory Council Chair of Operation Smiles Philippines. Fellow doctors and pediatricians, let's all welcome and give virtual applause to our speaker, Dr. Armando Sayao. Sir?
Thank you, Dr. Alvin, for that very kind introduction. Good evening, fellow PPS Southern Tagalog chapter. So I feel very at home, no, sa PPS, which is my chapter. So tonight, as mentioned by Dr. BT and of course Dr. Alvin as well, na the topic for this evening is actually very common. No? This is actually one of the symptoms that we commonly see in children. Unfortunately, because of the COVID pandemic, lahat ng cough na nakikita natin is actually COVID suspect, no? Unless proven otherwise. So tonight's lecture, hopefully, will be able to distinguish, no, the types of cough, not necessarily cough because of COVID. But of course, towards the end of the talk, we will also talk a little about the COVID cough. No? So let me just share my screen. Of course, thank you for the sponsor for tonight's event. Can you see my slide?
Yes, Doc.
Can you
Yes, Doc. Yes,
can you hear me clearly?
Yes, Doc.
Yes,
okay.
Doc.
Yes, thank you. So the topic for tonight's webinar is actually cough in children, a simplified approach to diagnosis. No? So this is my disclosure. The talk actually is different from the other lectures on cough, no? As we heard from other webinars and scientific symposium, wherein most of the discussion centered on some of the difficult, no, to diagnose cough. No? But tonight's webinar basically will talk about some of the common cough that we see in children, no? Some of them actually presents to us in our clinic, and one of the most common presenting symptoms that a child goes to our clinic is actually cough. No? My objective for tonight's lecture is to review the different types of acute cough in children that we commonly see in the clinic. And then specifically to define what is cough, to describe the signs and symptoms of cough that warrants medical attention, the types of cough according to duration, the approach to diagnosis of cough, to discuss the different types of acute cough commonly seen in children, and of course to talk a little towards the end to discuss the action of ambroxol in relieving cough. As I mentioned, most common medical complaint accounting for as many as 30%, 30 million visits per year is actually cough. No? Cough as defined, or ptosis, is a voluntary or involuntary act that clears the mucus, that clears the throat and breathing passage of foreign particles, microbes, irritants, fluids, and mucus. A cough is a child's way of getting rid of an irritant, either mucus or foreign body, which can be normal, or a symptom of a respiratory or non-respiratory disease. There are three phases to a cough. It all starts as breathing in or inhalation, immediately followed by increased pressure in the throat and lungs with the vocal cords closed, and then followed by explosive release of air when the vocal cords open, giving a cough its characteristic sound. Cough can be distressing in children and exerts a major impact on a child's sleep, school performance, and their ability to play. It may also disturb other family members as well as disruptive for school teachers, and it generates a considerable parental anxiety, especially to the family. No? What are the signs and symptoms of cough which warrants a visit to us, pediatricians? Of course, if the child who is coughing has difficulty of breathing, so dyspnea, rapid breathing, tachypnea, the child should be brought immediately to the doctor or the pediatrician. If the child who is coughing looks cyanotic in his face or lips, or a child's cough interfere with feeding, the child who is coughing makes him weak or even faint. A child's cough persists continuously for more than 3 hours, and a child's cough produces blood or discharge. So all of this actually warrants a checkup to the pediatrician. Chang and Lando et al. In 2006 mentioned different classifications of cough in children. It can be classified according to cough duration, acute, protracted, or even chronic cough. It can be due to an underlying disease or process, like normal or expected cough, specific cough or non-specific cough, or quality of cough, classically recognized cough, dry or wet, or versus wet or productive cough, and protracted bronchitis. For this evening's short talk, we will talk about cough according to duration. So classification of cough according to duration can be acute, wherein cough lasts less than 2 weeks, subacute cough, where cough lasting between 2 to 4 weeks, and chronic cough lasting for more than 4 weeks. So in this particular talk, we will talk about acute cough. As the title said, the simplified approach to diagnosis, Shield and Bush et al. In 2008 proposed a schematic diagram on how to diagnose acute cough. It all starts as a good history and physical examination, wherein the cough is actually less than 2 weeks as defined. And then if there is coryza and fever, it is actually attributable to acute respiratory infection, whether upper respiratory tract, exemplified by common colds, croup syndrome or bacterial tracheitis, or a lower respiratory infection, such as bronchiolitis, pneumonia, or even asthma. Now, if the child presenting with acute cough presents with the choking episodes, this might be because of an inhaled foreign body and should be worked up accordingly. If the child presents with the itchy nose or allergic salute, wherein there is a upward swipe of the nose, no, associated with sniffles, this can be a seasonal allergic rhinitis. Or if the child appears very ill with barrel-chested deformity and finger clubbing, this can indicate a chronic lung disease presenting as acute cough. Okay, as mentioned, we will talk about the acute cough commonly seen in children, and commonly seen, no, madalas nating nakikita in our day-to-day practice. Acute cough are usually caused by viruses. This type, it can either be productive, wherein the mucus is produced, or a non-productive, wherein dry or no mucus is produced. It can be a symptom of a chronic illness manifesting as acute cough. Now, we commonly see this in children with bronchial asthma or in children with pulmonary tuberculosis. It's a chronic illness presenting with acute cough. 50% of acute cough resolve in about 10 days, as described or mentioned by Thompson et al. In 2013. But in the event that it does not resolve in 10 days, it lessens in intensity by the second or the third week. What are the types of acute cough in children? As mentioned earlier, there are several types that we commonly see in our clinic. This is actually the phlegmy cough, or the most common. Ang tawag ng some of the parents would even describe this as halak, which is actually because of common colds. You see this in a child that sounds mucosy or halak, has a runny nose, sore throat, watery eyes, and a poor appetite. Of course, the most common etiology of common colds is rhinovirus. It generally lasts for about 1 to 2 weeks, which we label them as self-limiting, and are more cumbersome and most contagious in the first 2 to 3 days. Simonek in 2007 mentioned that children gets an average of 6 to 8 colds per year. How do we treat common colds? Common colds is treated supportively. We can use saline nose drops if the child is too young to blow their nose, or a valve syringe to help clear the mucus to lessen the coughing episodes. Basically, symptomatic treatment. Or the parents can also advise to use cool mist humidifier and warm bath, which can be helpful, no, to lessen the coughing episodes. Over-the-counter medicines are not routinely given in children less than 3 years old. And it is better to advise the parents that before they even self-medicate, they should consult at least or call, because nowadays it's telemedicine, or call their pediatricians before even deciding to give a over-the-counter cough medicine. How about barking cough, or the croup syndrome? You see this in a child who went to bed with a stuffy nose, has been sleeping peacefully for a few hours, then suddenly you hear what sounds like a barking seal. The age incidence of croup is usually between 6 months to 3 years. Croup, also known as acute laryngotracheitis or acute laryngotracheobronchitis, is a common viral childhood illness. It results in mucosal inflammation anywhere between the nose and the trachea. Of course, the most common etiologic agent are the para-influenza viruses, specifically types 1, 2, and 4. It presents as a harsh barking cough, including stridor, hoarseness of voice, and fever. It is commonly observed during the wet or cold season. So how do we treat croup or barking cough? The treatment is actually you can apply cold air or mists, which may help relax, no, the airways. No, as I can even remember during our training days or residency days, we even put these babies on crouppette. No, for those who are as old as me, no, I'm sure you know what a crouppette means, what a crouppette is. No, if the child is dyspneic or stridor that is getting worse, he should be immediately brought to the hospital. Between coughing attacks, it is best to advise parents to use cool mist, as I mentioned earlier, in the child's room and make sure he drinks plenty of water. Although croup is usually self-limited, sometimes medical consult may be necessary such that medications can be given, no, as needed. Another type of acute cough is the nocturnal dry cough, which is actually because of bronchial asthma. Again, we see a lot of this, no, nowadays, no. Sabi nga ni Alvin, sa clearance lang lahat ng pasyente tinitingnan natin, ang tawag natin doon, the comorbidity is bronchial asthma. Plus of course those living around
Doc, nakamute
Sir,
po
nakamute
kayo?
po, sir. Doc, nakamute po.
Napindot po yata yung mute.
na-mute ako?
Apo, na-mute po. Sorry po.
Hanggang saan?
Hindi, kakamute lang naman po yata.
So
Okay po.
accidentally na-mute ako. Anyway, so as I was saying, nocturnal cough or bronchial asthma, you see this in a child who has an annoying cough on and off, especially during change of weather and becoming worse every night or during physical activity, which we term as exercise-induced asthma. A dry cough may be caused by bronchial asthma, which is a chronic condition characterized by bronchoconstrictions and overproduction of mucus. Parents may think that wheezing is the primary sign of asthma, but a dry hacking cough, particularly at night, or nocturnal coughing, may be the child's only symptom. So it's actually just coughing, no? Especially at night, can be the initial presenting symptom of a child with bronchial asthma, not necessarily a child who wheezes and then or develop respiratory distress. The cough can be triggered by exercise, or what we term as exercise-induced asthma, or triggered by allergens, exposure to allergens, or an upper respiratory tract infection, or change in weather. How do we treat asthma? Asthma diagnosis should be first confirmed by the pediatrician, no, by us. No? The parents cannot make a diagnosis of asthma on their own. It has to be confirmed by the pediatrician. Physical examination and of course a reliable history regarding the pattern of symptoms, family history of asthma or allergies are enough to make a diagnosis. Inhaled bronchodilators is the treatment choice. And the new thing now is in the GINA guidelines of 2019, wherein SABA is no longer used, but an inhaled corticosteroid combined with a short-acting beta agonist or a long-acting beta agonist. Kids with moderate to severe asthma attack should be brought to the hospital, or if the child presents with dyspnea, unable to speak or eat or even drink. Another acute type of cough is what described as miserable cough, or the cough because of flu. No, this is actually common nowadays and common during the wet and cold season. You see a child with weak hoarse cough, with high fever, muscle aches, and sniffles. This is caused by the influenza virus, particularly types A, B, C, and D, wherein the virus attacks the respiratory system and causes a weak, hoarse type of cough. Flu has a long incubation period, so kids can walk around with the virus for days or even weeks before getting sick, and may even share this with their classmates, friends, and even other family members. It spreads through little droplets, so that when a classmate sneezes, no, in the class, so it can easily spread, no, to the entire class, even the teachers. Treatment for influenza, of course, is supportive, but we highly recommend, no, flu vaccination in the school age groups, no? And of course, give them plenty of fluids as well as paracetamol or ibuprofen for fever, and then to relieve the fever as well as the muscle aches. What about whooping cough? Of course, whooping cough are less common nowadays because of vaccination, but this is so common among the unvaccinated children. You see this in a child who has colds for more than a week and now having coughing fits, sometimes coughing more than 20 times in one breath. In between cough, child may experience trouble in breathing and makes a strange whooping sound as he inhales. The bacteria Bordetella pertussis actually attacks the lining of the air passages, producing severe inflammation that narrows and sometimes even blocks the airway. No? And then child will present to us in respiratory distress or dyspnea. It is common in children less than 6 months, especially those who are unvaccinated, and may require hospitalization. Babies may come in continuous bursts, ending with a gagging or vomiting. No? You might not be able to observe the whooping sound in young children. No? They may just be presenting with bursts of cough, followed by gagging or vomiting, and then may even stop breathing for a while, leading to cyanosis. Of course, as I mentioned, vaccination is given, no? A 5-dose vaccination given at 2, 4, 6 months respectively, and booster shots at 15 and 18 months and between 4 to 6 months respectively, totaling 5 doses. How do we treat pertussis or whooping cough? Of course, if a child presents with a whooping cough, the child should be seen immediately by the pediatrician. No, mother cannot self-medicate patients with the whooping cough because whooping cough requires antibiotic treatment. It is actually treated with antibiotics and actually very contagious. The antibiotic of choice is erythromycin, which clears up the infection after about 5 days if started early. But the cough or pertussis may persist for even months. How about a really gross wet cough? Really gross acute wet cough, or the cough of pneumonia. You see this in a child who has cough and colds for a week and is getting worse with high-grade fever probably. His cough is wet and phlegmy or mahalak and may even present with tachypnea or rapid breathing. Pneumonia is caused by virus or bacteria, which causes the lungs to fill up with fluids. According to Dr. Lonser, since the child is trying to get the fluid out of his lungs, a pneumonia cough tends to sound pretty ugly. Of course, when we talk about pneumonia, particularly bacterial pneumonia, this requires antibiotic treatment. But of course, physical examination as well as chest x-ray may be necessary to make a diagnosis of pneumonia. Oxygen inhalation sometimes is needed, especially if the child is presenting with difficulty of breathing or dyspnea. Bacterial pneumonia is treated with antibiotics depending on the age groups. Cefuroxime is the drug of choice for etiologic agent Haemophilus influenzae and strep pneumonia. Viral pneumonia does not require treatment and is usually self-limited. Of course, it is worthwhile mentioning that pneumonia can be treated at home, but if severe enough, the child may be admitted in the hospital, especially if they're presenting with respiratory distress, poor feeding, and or poor feeding. Of course, last but not the least, cause of acute cough is what we are having right now, what we are in right now in the middle of the pandemic, the coronavirus cough or the COVID-19 cough. Children and infants generally have mild cases of coronavirus infection. Actually, many kids remain asymptomatic. Others may get cold-like symptoms such as fever, runny nose, and coughing, as described by the Center for Disease Control and Prevention, or the CDC. Symptoms may generally show up 2 to 14 days after exposure. The corona type of cough is usually dry, but it could also be wet and productive. But most of the time, the cough of coronavirus is dry. Sometimes the child develops symptoms of COVID-19 or its complications that we commonly see, a multisystemic inflammatory syndrome in children, or MIS-C, which is another topic for discussion in another session. Let's talk about the over-the-counter cough medicine. Schroeder and Fahey in 2002 mentioned that over-the-counter cough medicines are the first-line treatment for acute cough and are frequently self-prescribed by parents or their caregivers. They are classified as mucoactive agents because it alters the viscoelastic properties of mucus and promotes mucociliary clearance, and categorized into groups according to their mechanisms of action. This includes expectorant, mucoregulators, mucolytics, and mucokinetic. A classic example of a mucolytic is ambroxol. The main mechanism of action of ambroxol is it stimulates the surfactant production. Some of the other mechanism of actions of ambroxol are: it has an effective mucokinetic and secretagogue properties, thus promoting mucus clearance, facilitating expectoration, and easing productive cough. It increases mucociliary clearance by increasing ciliary beat frequency in animal models. It also exerts antioxidant properties through direct scavenging and protection from reactive oxygen species. Ano yung guhit sa screen? It has an anti-inflammatory properties also by inhibiting leukocytes from secreting pro-inflammatory mediators. Ambroxol has a local anesthetic properties as well via inhibition of neuronal sodium channels, producing a possible antitussive effect. It has also a protective effect against viral and bacterial airway infections due to an increased number of substances that suppresses viral replication and affect bacterial biofilm structures, including immunoglobulins A and G. This is a representation of the known pharmacodynamic properties of ambroxol as described by Pagliari in 2011. As I mentioned earlier, of course, the main mechanism of action is stimulation of surfactant production, but it has also a mucokinetic and secretagogue activity. It has an anti-inflammatory and anesthetic properties. It has an antiviral and bacterial activity, as well as an antioxidant effect. Let me just present to you a study, although a little bit old. This was done in 1986, but this is just showing to you the efficacy of ambroxol as an adjuvant to antibiotic treatment in children with pneumonia. This was published in 1986 in the International Journal of Clinical Pharmacologic Research, entitled "The Possibility of Interaction Among Antibiotics and Mucolytics in Children" by Principi, Sabatini, and Daniotti. This is a randomized, double-blind, placebo-controlled study assessing the efficacy of ambroxol syrup as an adjuvant to antibiotic treatment in 120 children aged 1 month to 11 years with acute bacterial pneumonia. Both groups received antibiotics for pneumonia. A total of 60 children received antibiotic plus ambroxol, and the other 60 children received just antibiotic with no ambroxol, or they are the placebo group. Efficacy assessment includes daily assessment of fever, cough, dyspnea, pathologic auscultatory signs, and highest temperature. Radiologic examinations were also performed before treatment and at the end of the study. What were the results? By the end of the treatment, all children had a normal body temperature, normal heart rate and respiratory rate, and no cough or dyspnea present, irrespective whether they receive ambroxol or placebo. From day 3 onward, cough was reduced significantly faster in children treated with ambroxol compared with placebo. From day 4, pathologic auscultatory signs improved significantly more with ambroxol treatment compared to placebo. Additionally, pre-treatment radiologic findings were normalized in 79% of children receiving ambroxol compared with only 53% in the placebo group. What were the conclusions? It is therefore concluded in the study that remission of the cough, of the chest pathological signs, as well as the improvement of the lung radiological pictures were significantly more rapid in children treated with ambroxol than those who received antibiotic alone. So you might want to consider giving ambroxol to your patients with cough because of pneumonia and also receiving antibiotics as well. Okay, so in summary, we were able to discuss the definition of cough. We described the signs and symptoms of cough that warrants medical consult. We discussed types of cough according to duration, which is actually acute, subacute, or chronic, depending on the duration. We also presented a schematic diagram of how to approach children with acute cough to make a diagnosis. We also discussed the different types of acute cough commonly seen in children and what we commonly see in our day-to-day practice. And of course, I discussed also very, very briefly the action of ambroxol in relieving cough. Okay? Thank you very much.
Okay, thank you very much po, Doc Sayao. That is a very informative and comprehensive lecture about cough. And it's a good review to us, especially now we have to admit that during the pandemic, most of us, kuminsan nalilimutan natin or nakakaligtaan natin yung details of the history because nagmamadali tayo dahil ayaw nating mahawa. So as much as possible, hindi tayo malapit sa patient, mabilisan lang. And I really would like to suggest to the PPS Southern Tagalog to siguro we launch this kind of lectures among public health workers kung saan sila yung mga frontliners. You know, in mga health centers or frontliners, there are midwives and nurses. Sila yung nakaharap sa mga pasyente. Sila yung mga unang nakakarap ng mga inuubong to. So we have to educate them really. And most of our centers ay hindi naman or wala silang easy access to doctors. So this could be a good project by the Southern Tagalog Chapter PPS. And
actually, it is actually deliberate for me to make this lecture as simplified as possible because I know that this is the most common symptoms that we see in the clinic, and sometimes we tend to forget to make a diagnosis, and then we zero right away to COVID suspect, and sometimes it's just a simple cough, and then that just requires a simple treatment, basically supportive treatment.
Okay, Doc. Doctors, if you have question, you can chat. I think we have one question. Kilala ko yata yung nagpadala nito, Dr. Isidoro. Okay. What do you suggest, Doc, in situations where parents are sending text messages asking for cough meds na hindi nagko-consult? How do we answer those text messages?
Yeah, as I mentioned in the lecture kanina, we discourage, we discourage talaga yung text messaging or even calls. But because of the pandemic, sometimes we do not have any choice because we do a lot of teleconsult nowadays, di ba? So minsan we cannot help but advise the parents, but of course as we provide or give, no, if we are forced to give or agree to give over-the-counter medications, we need to tell them specifically what to look for, what to watch out for, no, just in case the progresses, and then of course give them time frame, like in 3 to 5 days time you don't see any improvement or worsening of the condition, you have to bring the child to the hospital right away or seek medical consult right away. So it's not that easy that once they give an over-the-counter medication, that's it. No? They expect the child to improve. No? There has to be a specific instructions that comes with the giving of the over-the-counter medicines.
Okay po. Actually, hindi lang po yan uso sa text messages. To us, sa public health, ang tawag po dyan ambush consultation. Usually, kahit wala yung anak nila, nagtatanong ko ang nagbibigay na gamot. And usually, they want antibiotics kapag meron pong ganyan.
Opo. Yeah. So, actually, ang kadalasan ang hinihingi, antibiotic pa nga eh. Doc, yung anak ko inuubo, anong antibiotic ang pwede ibigay? Ganun kagad eh, di ba?
Yes po, Doc. That's very common po. Ayun. So, any more question po? Question po pala sa Nurture Med. Ang Ambroxol po ba is already part of Philippine National Drug Formulary? Kasi sa DOH, they usually do not allow us to stock medicines which are not included in the PNDF. So, nasa PNDF po ba ang Ambroxol?
Anyone from the Nurture Med can answer that? Sir JP?
Sir JP?
Yes, Doctor, we still have to check that one po. If the Ambroxol is already included to the PNDF formulary po. We'll give you an update po with regards to that po, Doc.
Okay.
Thank you, JP.
We believe naman po na it is an FDA approved, but I think yung requirement po kasi for us sa health centers, for us to request at mag-stock sa aming pharmacy is that they should be included in the Philippine National Drug Formulary.
Yes, Doc. Opo. We'll give you an update on to that po the soonest po, so that we can provide din po yung pang samples or materials for that po.
Okay. Thank you very much po.
Yun po. Thank you, Doc.
Any more questions, doctors? You can raise your hand. Hindi ako sanay sa chat. Pero wala naman po ibang questions dito. Any more question? While we are waiting, I would like to say thank you sa mga pediatricians ng Los Baños for helping us in the res bakuna. Shout out po sa inyo for palaging handang tumulong sa res bakuna ng Los Baños. Maraming salamat.
Pa-shoutout na rin kasi kanina naman sa San Pedro, Laguna, nag-res bakuna na rin kami sa Westlake Medical Center. At last November 5 naman sa De La Salle University Medical Center.
Okay. So far po ay wala po tayong question.
Okay.
Dr. Sayao. Just to add up lang po on the chat box po, sabi po ni Dr. Nelson Buni, good evening Manding, it's nice to see you again giving lectures. And of course, I'd like to highlight din po si Dr. Ernesto Lat. Sabi po niya, good evening everyone and regards to Dr. Manding Sayao. Yeah.
Regards Nelson and Ernie, kailan tayo mag-golf?
Doc, may question po dito. How about the use of nasal drops for less than 6 months for halak? Advisable din po ba? From Dr. Lat. Dr. Ernesto Lat?
Actually, pwedeng bigay, pwedeng hindi. Depende, no? As long as merong proper advice sa parents on what to watch out for, no? Kasi minsan na parang nalulunod yung mga bata if you give them, no? So what I usually instruct my patients, no? By the way, I'm also practicing general pediatrics, not only pediatric critical care. So what I usually advise my patients is after you give the nasal drops, you immediately followed by nasal suctioning using a bulb syringe or a rubber syringe. So to prevent actually lunod or what we term as parang naga-aspirate sila. But of course, oral medications is definitely contraindicated in children less than 6 months. Thank you for that question, Dr. Ernie.
There's a message daw po. Anytime daw, Doc, for the golf. Okay.
I think yan ang pinakamagandang tanong na nakuha ko ngayong gabi.
Yes. Dr.
Yes,
Isidoro, regarding po the question po kanina regarding Ambroxol for PNDF po yata, there's actually nag-direct message po siya. Thank you for the lecture. Non-PNF po ang Ambroxol daw po. Sabi po ni Dr. Cherry Ann Sacro. So
at the moment, non-PNDF siya.
Yes po.
Yes.
Okay po. Okay. Thank you, sir. Sir, isang question lang. Regarding dun po sa, tama po ba yung sa Cebu, yung ina-advocate nila tuob? Tuob po ba yun?
Tuob?
Tama ba? Tuob?
Actually, di ba parang during the time
inhalation?
during the early years, steam inhalation. Diba? It's actually a steam inhalation. For a while, it was stopped already, diba? So during our residency training days, not too long ago, inaano natin yung steam inhalation. Pero there are some complications that actually observed, especially burn, no? Susunog yung mukha ng mga bata. So we stopped recommending it and then just recommend nebulization with the saline solution. I don't see any study saying how effective the tuob or steam inhalation is, especially for COVID patients. No? So wala namang lumabas na study regarding that. But yung mga traditional still follow the old ways, probably, no? Continues to use it. Especially the governor of Cebu who recommended it, di ba? Siya pa yung nag-recommend. Namimigay pa nga ng mga ng mga paraphernalia for steam inhalation. So it's not recommended actually.
Okay.
And there is no study, no, to say that it's effective.
Okay. So may message dito. Thanks, Doc Sayao. The study cited used Ambroxol in 1 month old. Do we use mucolytics now for less than 6 months or 2 years old?
Normally po hindi. It was the study done in 1986 pa. But the study actually just highlighting, no, that you can use Ambroxol as an adjuvant, no, for the treatment of pneumonia as an adjuvant to antibiotics for the treatment of pneumonia. But nowadays we are not actually encouraging it. Thank you, Dr. Yoyi, for that question.
As Dr. Yoyi talaga. Okay. So, thank you very much po. Any more question? Kung wala na po ay let me turn over. But inulit ko po, maraming salamat po sa lahat ng pediatricians na tumulong sa amin. And kay Doc Mandy Sayao, maraming salamat po. It's a great, it's a good review to us, really. Especially now na bumabalik na ulit tayo sa normal, hopefully, sa normal condition.